This is Larry Cooley, and I'm really pleased to be with you. It's a special privilege as somebody who's been involved in this community of practice since we started 7 years ago to watch it go from a kind of a struggling infant to being a rambunctious teenager. But I must say it's a labor of love for Johannes and myself to watch that all take place. And thank you all for joining us today. I'll say just a few words by way of introducing both the COP and the session, and then we'll jump right into the substance of it. For those of you who've been with us from the beginning, you'll know that we started about between 7 and 8 years ago as an experiment, basically to see if there was enough interest in the issue of scaling to assemble a group around it. And here we are, having grown from 30 members then to 2,500 now. 7 of you being designated sustaining members, meaning that you contribute a little bit of money to help meet the logistic costs of the network, but without any more power than the rest of us. This is entirely and completely a volunteer-driven organization that's based on the goodwill and the enthusiasm of the members. That means you. And so what you put in is what you get out. What you put in is also what the rest of us get out. So thank you for being here today and also for all the other things that you do. Let me just give you a little bit more overview on the community of practice. As I said, we're 2,500 members now from something over 400 organizations in 60 countries, including, I'm happy to say, about half those countries in the global south. We have 9 working groups, all of which you're welcome to join, none of which have any costs associated with them. We have a website, which is www.scalingcommunityofpractice.com. We have newsletters quarterly, of which there have been 25 so far. We have annual workshops. This is our 7th. And we've done a series of thought products. I'll give you a sense of what those are just to get a feel for them, but they're all available on the website. One was a new consensus around what we really mean by scaling and what the community is coming to understand by as being both the determinants and the consequences of a successful scaling. Then we did a second piece trying to compare and relate systems change and scaling, because we found a lot of miscommunication between those two communities, but also a lot they could learn from each other. Then we did a third piece on principles of scaling and some of the most basic lessons from scaling. We've done quite a lot of work on scalability assessment. How can you do a kind of a scan that would give you a sense of the probability of something going to scale? We've done work and thought products on institutionalization. What does it mean for something to be really institutionalized in a host country government? And what do we know about promoting and tracking that? And then the one we're going to be talking about today, which is mainstreaming, a new stream of work for us, which is what does it really take for a systemic focus on scale to really find its way into the basic practices of funder organizations. We've also, in the last year, done a strategic plan for the community of practice that tries to outline both ways to consolidate what we've done and to take the next step, and that agrees that we're really an advocacy group only on one issue, which is to try to get the world, implementers as well as funders, to be clearer and more professional about the way they approach issues of scale. As I said, this is our 7th annual workshop. And for the last 3 years, initially because of COVID, and now because of inclusion, we've decided to do these sessions virtually rather than in person. And that takes the form, rather than a 2-day workshop, which is what we originally did, of 11 90-minute sessions, one each day for the next 2.5 weeks. This is the first. 3 of those sessions will be plenaries. This one today talking about institutionalization, one tomorrow talking about the role of information technology in scaling, and one on the last day trying to sum up what we think we know about scaling at this point in time and charting a course for the community and for the issue going forward. Today's conversation about scaling is going to focus, as I mentioned, on the issue of mainstreaming. In particular, what does it look like if you're a funder organization? And I can tell you, having myself worked on this for a while, it's disarmingly difficult when you actually start to peel it back. What needs to change, fundamentally needs to change in some of our organizations in order for that focus on scaling to be as systemic as it can and we think should be. And we're going to try to peel that onion for you as best we can. Johannes Linn will be chairing that conversation, he'll be joined by three completely perfect people for this. Richard Kohl, who's done the background paper for this, Bridget Rivera, who's with CRS and heads their work on high-performing implementers related to Global Fund, and Julie Howard, who used to be the chief scientist at USAID and has been a founding member of the Global Community of Practice, and particularly its agriculture working group. Let me turn now, if I could, just to a couple of logistics before I hand it over to Johannes. First of all, for those of you who are used to doing these kinds of sessions with an active chat function, we have an even more active chat function, but it's not through the chat function. You'll see if you look across the top of your screen, there's something that says Q&A. We're going to use that, not chat. So if you go to chat, it will say there's no chat. Instead, you need to go to Q&A. When you go to Q&A, you'll be given two options. One is actually, in effect, three options. You can start a discussion, ask a question, or comment on someone else. Respond. So if you go for right now for just 1 second to the Q&A box, you'll see one that Gabby put in that says, for example, welcome to the Scaling Community of Practices workshop. Please join in the conversation. And right below that, you'll see a place you can comment on it or respond to a question. And we hope you'll do exactly that, because what that will do is keep those things going as chains of thought. If somebody wants to stay in the same conversation or comment on someone else's. If you go all the way up to the top, you'll see a little not particularly great picture of me, and it says ask a question, and you'll see right next to that a little thing with a question mark in it. If you click on that, it says ask a question or start a discussion. So if you're the initiator of something, if you're bringing up something, what you probably would have done in the chat before, go there and put it in the form of a question or discussion that you want to start, and then we encourage other people, even as the speakers are speaking, to build on that by either responding to a question or adding their own comment to a comment, so that we can hopefully keep this going as a lively exchange even as the speakers are sharing their remarks. When you're not on camera, we'd ask if you would, when you're not speaking, we would ask if you go off camera as well as on mute, so we don't get background noise and so people's bandwidth is preserved to the extent possible. I hope that was clear. This is a little bit of an experiment for us. There's one more thing I want to make available to you, which has to do with captioning. For those of you for whom English isn't the first language, or who prefer to see captions at the bottom, that possibility exists. And what you need to do is you need to go up to the top again. This time you go to the place that says more. It's got three little dots there. And select a language. The language you would select is English, because the speakers are going to be speaking in English. Then you, again, on the right side of that, can click and choose the language you want captions in, and you'll get captions in that language, we hope. This is an experiment on our part. We hope it's not distracting. We hope it's really helpful for those of you who are kind enough to join us, notwithstanding the fact that English isn't your first language. So again, two special features, maybe a little bit atypical for you. One is the way to access the live captioning. The second is the way to both ask a question, start a discussion, or comment on somebody else's. If some of you, I'm seeing comments already about people who are on Mac, and I'm not sure I know the answer, but we'll try to get somebody to answer back to you on that. And hopefully those of you who are English speaking can at least follow the discussion as we're going to be proceeding. We hope we can also solve whatever technical problems you have for entering questions and comments. With that, let me hand over to Johannes to introduce a little bit more his panel and the subject, and welcome you again very much to today's sessions, and we hope as many of the other 10 sessions as you're able to join us for. Bye-bye, see you later.
Thank you very much, Leif, for this introduction and of our wonderful undertaking that we've been partners in, working over the last 7, almost by now, by the way, 8 years. I'm really delighted that we have our 7th workshop starting now. And I welcome everybody who is joining us, whether it's morning, afternoon, or evening, wherever you are. So thank you very much for being here. May I remind everybody, please, to mute your microphone so we don't get additional voices online. That'd be great. Thank you very much. So today's topic, and maybe we can put the slide up, Gabi, that for today's topic. Today's topic is mainstreaming the scaling agenda in donor or funder organizations. And I'm very happy to introduce a number of speakers who, beside myself, will share with you some of their experience and some of their views on how funders have or have not supported the scaling in the recipient organizations that they are supporting. The speakers that we have, and not necessarily in the succession in the role in the order in which they will speak, are Bridget Bucardo Rivera, who is from the Catholic Relief Services and serves as a senior official there. We have Julie Howard, who is the Global Food Security Program in CSIS and used to be in USAID, serving as chief economist of the USAID's Food and Agriculture Program. We have Richard Kohl, who has a long career in developing and supporting scaling. And he is, in fact, one of the authors, or a principal author of some of our knowledge products that we have issued under the auspices of the community practice. So this is the panel, and it is my job to start introducing the topic with a little bit of history, and then an introduction of the new knowledge initiative that we're about to start. In fact, have just about started on mainstreaming scaling in funder organizations. Gabi, maybe you could put up my slides now. And so with this, let me start. I myself have a bit of history on this topic because I've actually worked for a few years, both in a funding organization for 30 years at the World Bank, but then the last, by now almost 20 years in working with various funding organizations on helping them mainstream the scaling agenda into their organizational practices and policies. Now, maybe the first question we might want to address, next slide please, is why is it that we should worry about whether and how funders focus on scaling? So the short answer is, of course, that, you know, in the first instance, very important, is always important to remember, is that it's the implementers and the recipients that ultimately have to do the scaling that needs to be done, whether it's innovations, whether it's projects, whether it's an ongoing program. It is the implementers, it is the recipients of whatever funders are providing that are the ones who really have to focus on and implement the scaling process. However, funders do create, in my experience, important incentives, or for that matter, disincentives, perhaps even more frequently disincentives for implementers and recipients in a number of ways. What they fund is very important decision on the funder's part. Do they fund principally innovations, or do they actually fund scaling? That's just, of course, one dimension of the funding decisions, but from our perspective, it is a key funding decisions. In our experience, many funders focus more on innovation and focus more on one-off projects than they do on actually funding scaling up pathways. How they fund matters, whether they fund through grants, loans, equity, or otherwise, because different stages of the scaling pathways may require different instruments of funding. Whether or not they provide technical assistance that supports scaling, whether their conditionalities, many funders apply conditions to their funding, whether in fact they include and focus on enabling conditions for scaling, whether they have in their own operational and funding policies and processes, whether they are supporting a scaling approach, and finally, whether or not their monitoring evaluation focuses on not only on the immediate impact of a particular project, but also on indeed on the scalability of programs, and ultimately on the scaling that needs to take place to get impact at scale in what they are supporting. Now, the challenge that we found, I found personally, but more generally, I think we found, is that it is actually not that easy, as Larry also just mentioned already, to get funders to focus systematically on supporting the scaling by implementers. And so why is that? Let's maybe move on to, not to the next slide, but the following slide, Gabi. That we are. So what is the problem? Well, it's a tough challenge. While it is an opportunity for funders, it's also a tough challenge, because the traditional one-off project approach with a focus on narrow project results rather than on whether projects support a longer-term scaling pathway is deeply embedded in what funders are doing and how they are organized and how they're traditionally pursuing what they're trying to achieve. Moreover, many of the larger funders in particular have internal stovepipes. I remember that very well from my World Bank experience, but also working with other big funders. And there, of course, is external fragmentation, meaning that there are lots of funders doing lots of one-off projects, but they don't necessarily add up to actually systematic support of scaling pathways in the recipient countries. We have traditionally observed that there is the predominant focus of funders on innovation rather than on innovation for sustainable impact at scale. We also found that the comprehensive change in vision, mindsets in bureaucratic policies and procedures, and in organizational incentives is actually difficult to achieve. And it's made more difficult perhaps because staff and managers are bombarded with what they think often are new fads that they have to respond to. And so many see, when we now talk about scaling as a new fad, and oh my God, my eyes are clouding over, is kind of the reaction. Why don't you let me get on with my business and we'll get something done here, rather than actually seriously focusing on scaling. And finally, there's, of course, in funders as well as in recipient countries, frequent turnover in leadership and staff. But bottom line from our perspective is, who've focused on this, is that we need to continue focusing on this challenge, and because it is also an opportunity. And so I'm very happy to say that the community practice, under the leadership of the executive committee, has now started a new research initiative. Next slide, please. Actually, something we call an action research initiative for the community practice. And this is based on a discussion actually we had at the last annual workshop in November of 2021, where we had a plenary session that spent about half the time on precisely the topic of mainstreaming. We had an excellent background paper that Richard Kohl prepared, and he will be summarizing some of his findings in a minute based on surveys and interviews that he carried out. And so we feel we're ready now to actually engage in action research. By action research, we mean work with funding organizations to help the mainstream scaling, to collect and share evidence, and to draw and share lessons from the evidence that we have collected, and from the joint work with our partner organizations. Now, this is potentially a multi-year undertaking. What we have defined is, and let's go perhaps to the next slide, Gabi. We have defined a longer-term vision. If you go to the right side of that big arrow, where over a 5 to 10 year period, we hope to have perhaps near universal adoption of scaling by funders with improved development and climate action results on the ground. So that is kind of the long-term vision. In the medium term, that over the next 3 to 5 years, we hope to support widespread understanding among funders why scaling matters, and to have the lessons of mainstreaming experience learned and selective adoption of scaling among the funding community. Now, in the immediate future, the 2 to 3 year period now is immediately ahead, we would like to work with partner organizations on reviewing their and hopefully adapting their current funding practices to focus on scaling. that we will extract some initial lessons and share those widely within the community of practice and the funding community. So in effect, what we have here is a bit of a scaling project ourselves. But of course, we're starting now, and so we will focus on the first 2 to 3 years. Next slide, please. And for those first 2 or 3 years, we have identified 5 components in the work that we want to carry out. This is all summarized in a concept note that we have published and put on our website, and actually was, I think, included in the invitation for this session. So you can see the details of our work that we want to undertake. But just very briefly, 5 components at the agency level, funding agency level. We'll be working with partners, the funding partners, on scaling reviews and support the individual funders. In the first year, we have already established partnership with the Agence Française de Développement, the French aid agency, with the German aid agency GIZ, and we're looking for 1 or 2 other funders with whom we will work. We will also review evaluations of funder programs to see whether there are any lessons to be learned on scaling, and we will identify additional funding partners for the second year of this action research initiative. We also, very importantly, want to work with implementers and recipients and get their perspective on funder practices as they support or do not support the scaling at the recipient level. In the first year, we'll start with a survey of recipients and also try to identify possible recipients for in-depth partnership on this topic in our second year. Now, there's also a systemic level at which we would like to work, namely with umbrella organizations supporting and assessing funders. In the first year, we'll be cooperating with OECD DAC and explore cooperation with MOPAN and the Global Evaluation Initiative. Then there's initially a limited amount of implementation support. We hope to develop a tool for tracking mainstreaming in funder organizations based on a tool already developed for institutionalization of scaling in recipient or in government organizations. And finally, we have an outreach and promotion track of mainstreaming in funder organizations, where in the first year we'll be engaging with, of course, selected funders and try and sort of do the outreach among funders, but also have more broadly webinars with COP members and broader audiences. And indeed, that gets me to the next slide and penultimate slide. The outreach program for 2023 is, of course, this particular workshop already. We're focusing on in this meeting on a couple of particular contributions that we'll have with the next panelists. But we also have 2 more sessions among the working group sessions that deal with funding. The Social Enterprise Innovation Working Group will focus on mainstreaming funding on the 6th of February, and the Health Working Group session on the 7th of February will also focus on the mainstreaming topic. And we then plan webinars with GIZ and with the Catholic Relief Services and Global Fund in March and April respectively, and expect to have other webinars with partner organizations to share their experience subsequently. Finally, the annual workshop 2024, we would of course report on progress and next steps to make sure we keep you all informed. Finally, and that's the last slide, I just want to flag there'll be opportunities for COP members, community members to participate and engage with us. As I mentioned, the current partners are AfD, GIZ, and also CRS. And we have already firm partnership with OECD DAC Innovation Unit. And we have funding secured from AfD, who very generously are supporting that, as is our community practice core resources, and we have pro bono expert contributions for the first year. For the second year, we don't have funding yet. So future opportunities for members are, you can share any time with us your own analysis and experience if you are funders, or for that matter, importantly, recipients. Please share your experience on the scaling support by funders with us. You can participate in online surveys that we'll be organizing. funder organizations can offer to support us in our action research as partners if you're interested. And finally, if any of your organizations would like to support this initiative with funding, which we will need, especially for the second year, we would also welcome that very much. So I thank you for your attention, and I thank you for your support in the past, and also very importantly, your support in the future on this, I think, really potentially important and very exciting new initiative of the community practice. I now have a question for you, Larry. Larry, will you take over the moderation from here, or shall I continue?
I will gladly do that.
Thank you.
Just to say, I want to test something here. I've gotten messages from a couple of you that you're having trouble with the Q&A function. If maybe, let me call on a couple of people quick that I see. I see Ruth. Does the Q&A function work for you, Ruth Simmons? Come off mute for a second.
I haven't tried it, Larry.
Do you see the little button up at the top that says Q&A?
I do.
Okay.
I do.
Okay. For those of you who don't, we're going to try to find a workaround on this because we really want to hear from you on this. We'll see if we can't mobilize the chat function also, because I'm going to ask you to try and guide our discussion, not only with your questions, but with your suggestions about where we go forward on this research. And that obviously only works if we can connect with you. So we're going to keep working on that. Those of you who can access the Q&A function the way I described before, please do, because I think that's the easiest way to keep a coherent conversation going. If you can't, then we'll try to find an alternative for the rest of you. What we'd like to hear from you on, even as you're listening to Richard and Bridget and Julie on this, we'd like to hear your thoughts as to what we can focus on as we do this research over the coming years. And also, if you know of other experience that we should be looking at in terms of trying to get a sense as to what the donor constraints and possibilities are as they try to mainstream a focus on scale within their own activities. This is not it is a research activity, but it's not an academic activity. We want to try and move the practices of donors on this. So the better we understand it and the more reticulated that information is, the better job we're going to be able to do. And we're counting on the community of practice, not simply as recipients of that information, but as the source of a lot of it. So please, if you can help us, start now by putting stuff into the Q&A or the chat box. If for whatever reason it's either technical or you're just not ready to do it yet, please follow up with us afterwards. That's our entire intent in trying to expose this for all of you. Let me turn next to Richard, and Richard has been, as Johannes mentioned, at the center of this in terms of trying to get a feel for what's already going on in the funder community, and also where we might be most useful, both in generating more information and maybe collectively pushing on some issues. So we've asked Richard to summarize that research for you in about 15 minutes. And then we'll use that as the grist for some of the comments that Bridget's going to make specifically around one initiative, and Julie around her experience trying to make this work from a donor perspective. Richard?
Hear me? And this, can you see the screen?
Yes, we can hear you now.
And you can see the screen?
Yep.
Great. So thank you, Larry and Johannes, for those nice introductions. Hello, everybody. My name is Richard Kohl. As Larry and Johannes mentioned, last summer, I spent several months doing a short study, exploratory study for the community of practice on what was the status of mainstreaming and how might we go about doing a more in-depth study. The questions that the paper, or the exploratory paper, and I really want to emphasize this was a very preliminary study. It was based on around 15 interviews, largely with people who were already working or had worked in donor organizations, whether bilateral, multilateral, official ones, or also several foundations. And it looked to confirm the hypothesis of whether or not the amount of mainstreaming was actually as limited as most people thought. What, to the extent there was mainstreaming happening, what did it look like? What form was it taking? What was driving it? And where it wasn't happening or not happening much, what was behind that? And then to develop some hypotheses and topics for a fuller study, which Johannes mentioned is now going ahead with hopefully several funders, beginning with Agence France de Développement and hopefully several others. We had also included in that study a survey of the COP membership, and around 50 people responded, and that information was incredibly valuable. So as Larry has already indicated, and Johannes, moving forward, we can hoping to continue that tradition, because your actual experience, either working in a donor, working with a donor, or funder, has proven incredibly valuable, and it was valuable in this study as well. The we also tried to do a literature review and discovered that while there is a vast amount of literature on scaling up, how to do it, case studies, guidance, as Larry said, assessments, all sorts of good things like that, there was almost no literature on actual donor practices, what they do or don't do to support scaling, how that works, what's been successful or not. So there's a vast gap in the published, and we looked at both the gray literature and the peer-reviewed literature and found basically nothing except largely the work of Johannes Linn, which we were obviously already familiar with. As I signaled, what we found is that very little has been done to systematically mainstream scaling into official multilateral and bilateral donors. What is happening is largely limited to an inclusion in mission statements and strategies, though several of the organizations we talked to said that when it's in the formal 3-year plan, 5-year plan, mission statement, etc., it does get a lot of staff and management more moving towards doing something about it. We found that at GIZ, for example, we found that at Global Affairs Canada and IDRC, that even though there isn't a lot beyond mission statements and including it in strategy, simply including that was enough to get a lot of conversation going within the organization, and increased awareness was built. Some organizations, donor organizations, are including it to one degree or another in their monitoring and evaluation functions. And this is a rather complicated topic that I'll get back to. Some organizations have multiple types of monitoring and evaluation. Some is done by independent parts of their organization that report usually to the board of directors or maybe to the president or CEO. Others have internal evaluation functions that are within the operations function. And we found that those organizations that do include scaling, interestingly enough, if it's part of the internal operations team or function, then it does have some impact. But when it's seen as done by independent parts of the organization, it's often seen as critical or hostile, and there's a lot of resistance to adopting this. Obviously, I'm making gross generalizations, but that was a pattern that we perceived. One of the most interesting things, and I think that Johannes referred to this, is that there's almost no mention of scaling in the DAC guidelines. And many donors, particularly official bilateral donors, use the DAC guidelines as really the template or the starting point for their monitoring and evaluation designs, formats, the things they look at, the issues and indicators they measure. And the fact that this is not there is one of the reasons that there isn't a lot of emphasis on scaling in many bilaterals in particular. The fact, however, just to conclude, that much of scaling has not been mainstreamed into donor organizations' actual practices on a systematic basis doesn't mean that scaling isn't happening. We found a lot of evidence that to one degree or another, scaling does happen in organizations, but it does tend to be, or funded by organizations, but it does tend to be largely ad hoc and opportunistic, not systemic or systematic. The obstacles to this are several, and this is not a complete list. First and foremost, one of the things we found, and to be fair, this is an issue that I think has belabored or bedeviled the scaling community itself since its inception and beyond, when Larry and I and Ruth Simmons and others started working on these issues almost 20 years ago. There's no clear definition that's commonly used about what scaling is, even within an individual organization, or how to measure it, or what the goals of scaling are. And in fact, there are often conflicting definitions, even within the same organization. Some emphasize sustainability, some emphasize systems change, some emphasize doing more, some emphasize scaling within a project versus creating the preconditions for ongoing scaling. And this creates a lot of challenges, particularly often between what might be defined as scaling in the headquarters, like USAID in Washington, D.C., or in Berlin or Frankfurt in the case of GIZ, or in Ottawa in the case of Global Affairs Canada, versus what individual actors in country, whether it's a country mission or a country project, might be doing. As I alluded to a few minutes ago, while it may be in a strategy, very few organizations have actual guidelines when they're designing a project or a program or grant-making criteria in terms of what grants they might approve that include scaling. And when it's not included in the guidance, there's very little incentive to do it. Again, this does occur on an ad hoc basis, particularly for those organizations that are working closely with a government partner as part of their business model. If the government does want scaling, they sometimes get it, but even some of the government actors we talked to said that they want a scalable, sustainable model, and there's often resistance from a donor because they have a limited funding, or they have a 3 or 5 year time frame, or they have to have concrete, measurable, objective, quantitative outcomes, such as number of people reached, and scale is not realistic, so there is often even push and pull there. Similarly, there's rarely allocation of specific financial or human resources. Very few donor organizations have a pool of money that is dedicated to scaling. A major exception to this, to some extent, are funders of innovation, such as Grand Challenges Canada or USAID's DIV program. But those innovation funders, as we'll come back to, have very limited resources. DIV, for example, I think current budget's around $20–25 million, while they recently did something innovative where they raised the ceiling on the amount of money they could devote to scaling. I think it's now $5 million. You can well imagine how many multi-million dollar grants can you put into a budget for scaling when the entire budget's $25 million. Similarly, I have yet to come across an organization that has a chief scaling officer or any title like that. And we've discovered that when there isn't a bureaucratic commitment of an office or a person or several people dedicated to the scaling function and trained with it with the skills and resources to do it, it often doesn't happen. You can often tell by the organogram or the org chart how seriously scaling is taken. There are beginning attempts in several organizations to start to provide scaling training for their staff. Some of the CGIRs are now putting this in place, and IDRC in Canada is also moving in that direction. But these are few bright spots in an otherwise non-existent picture in terms of training or dedicated human resources. As Johannes alluded to, almost everybody we talked to, including the Scaling Community of Practice survey, alluded to the project approach, which is dominant among many, many bilateral and multilateral official donors, is a major obstacle with its short fixed timeframes, limited quantitative objectives, rigid work plans and activities. Particularly contracting mechanisms can often be around projects that are not implemented by the donor itself, but that are contracted out. All of these things, if you look at them and you compare how projects are designed with the principles paper that Larry alluded to in his introduction, which you can find on the Scaling Community of Practice website, are almost orthogonal or inimical to good scaling practice. Also, as Johannes alluded to, there's a strong bias in the donor community towards innovation, towards what some might call discover and develop, but not deliver. Very few organizations have a mandate to go all the way from innovations and piloting and providing evidence and documentation of costs and impact to taking things to scale and to supporting their institutionalization and sustainability. Most are very front-loaded, and I heard from many people I interviewed that in their organization, scaling is taken for granted, but it's somebody else's job. If they can come up with a high impact innovation that addresses a pressing issue that's urgent, either because of need or because of demand, whoever, they assume that it will go to scale, but whoever does it is someone else's responsibility. And in a few organizations, scaling is actually seen as sort of a pejorative, that it's the grunt work or plot, they call it plotting, that other organizations do. But you know, we're the high flyers. We come up with the brilliant ideas. It's someone else's job to do the dirty work of implementation. Again, as I said before, that doesn't mean scaling isn't happening, but you can see that this list of obstacles is very hostile to creating systemic mainstreaming of scaling in donor organizations. Now, there are a few bright spots out there, and you may have noticed that I have been largely referring in terms of the limited mainstreaming and the obstacles to official organizations, bilateral, multilateral donors. One of the places we've seen a lot of this, number 4 here, is in small and medium-sized foundations. There are several foundations that have taken scaling seriously, and perhaps one of the reasons is that these organizations have a lot more control over what they do, their internal structure, administration, bureaucracy, as compared to official organizations. Eleanor Crook, which has been very active in the community, is a wonderful example of that. And there are also several big bet foundations, such as MacArthur's 100 and Change, the Audacious Fund, and Co-Impact, all of whom are active in the community of practice, and their example is much appreciated. That said, within some of the official donors, there are bright spots. For example, USAID's Health Bureau has been very innovative and has published a number of papers on this, including guidance documents for its projects, as well as supporting financially. And the same is true with the part of USAID that Julie Howard was the chief economist at, what used to be the Bureau of Food Security and Agriculture. Now it's called, I think, Resilience and Food Security. There are also, as I mentioned, a number of internal innovation funders, such as Grand Challenges Canada, that are supporting scaling. However, because of their limited resources, they tend to are only able to support scaling up to what they call transition to scale grants, which support preparing an organization for scaling or taking something to scale, but they're not actually the going to scale. They just don't have those kind of financial resources. Perhaps the place where a lot of scaling has really been mainstreamed are vertical funds, such as the Green Climate Fund. And one of the reasons for this is that they, like foundations, are a little bit more independent of governments and are able to create their own infrastructure, their own organizational structure. Many of them are fairly new in the last 10 or 20 years, like the Green Climate Fund. They have a very narrow focus. It's often single issue or a small number of issues that are interrelated. And by definition, since they are supposed to, their narrow focus on one issue or one subsector allows them to take things all the way from innovation to scale. And they do have accountability for this. For example, the Green Climate Fund does have a set of criteria for scalability in I believe there are grants or partnership agreements that they make. And the last thing I want to say on this is that there's a bit of confusion, I think, among donors about saying we're going to devote whatever the number, 30 million, 50 million, 100 million, or hundreds of millions or billions of dollars to a sector, is not the same thing as scaling and taking individual projects, programs, interventions, innovations to scale. And I think this is an example of the kind of confusion. So what drives scaling? We found, and particularly the survey information was very helpful on this, that it's mostly top-down, that it's mostly an individual leader or a senior manager will support this, and they will want scaling to go forward and lead that effort. We found that to be the case at the International Fund for Agricultural Development and other places such as the Eleanor Crook Foundation, where this really was a major driver. By contrast, as I mentioned earlier, evaluations do not seem to play much of a role unless they're internal, but the external ones are often perceived as hostile. And similarly, pressures from Board of Governors can easily be, how to put it, sure, there's a biannual meeting, or there is a funding round where there is a pressure from country members for scaling, but this kind of gets lost, because these meetings are annual or every 2 or 3 years, and the accountability within them is limited. And we were told by insiders that, yeah, we can put together a paper that talks about it, but they don't really get their hands dirty. They don't really know what's going on operationally, and how much actual scaling that translates into is quite limited. So in conclusion, we do need a study. There was uniform agreement among everybody we talked to that in-depth studies of mainstreaming among donors and foundations was needed. It should emphasize the positive and offer more support to advance mainstreaming, even if it's only in its infancy. It should use a comparative case studies approach, though one of the challenges of a comparative case studies approach is what happens when you include in that different types of donors. How do you compare a USAID to an Eleanor Crook Foundation, to the Green Climate Fund, to the World Bank? And if we confine ourselves to just bilaterals or something, then we don't include a lot of the donor community. If we do everybody, we face this challenge of comparing apples, oranges, pears, and grapes. A second area of disagreement was, what should the study focus on? Should it only focus on mainstreaming in the sense of what has a donor done to internalize it in terms of its guidance, its incentives, its funding? Or should we actually look at how much that translates into actual scaling activities or even impact at scale? And finally, here is a list of some of the things that was suggested as topics to look at in terms of what a series of studies could look at. What drives mainstreaming? A particular issue was often that middle management, if it doesn't buy in, can prevent scaling from actually happening on the ground. And we kind of already alluded to this, the difference between headquarters and country missions, or between senior management and operational staff, that there can be a lot of either explicit or tacit resistance that prevents things from happening. And similarly, how our bureaucratic structures and procedures, such as the contracting mechanisms, monitoring and evaluation requirements, et cetera, are often obstacles, but hopefully could become facilitators of scaling. A particular issue that many people raised was the role of partnerships. But again, this was a bit of a mixed bag. Some organizations everybody talked about it as a wonderful mechanism, but they all agreed that their own actual experience with it in their donor organization was very mixed at best. It's very difficult to align different donors and foundations with on the same issue, to do it the same way, to measure it the same way, to share or divide up roles and responsibilities. And so while partnerships may be wonderful in principle, getting them to work in practice has proven difficult. And last but not least, I think there's a general assessment that even if donors do mainstream scaling as part of their activities, scaling is hard. And almost all donors like to see the majority, if not almost all of their projects, programs, grants as successful. Scaling, even if it's done according to the wonderful principles and experience that many of us have had, is still a high-risk venture. And do donors have the tolerance for the increased risk, even if the returns would go up dramatically? In other words, many donors are following a low return, low risk model that they don't try to do things at scale, but they do things at very limited scale. And they tend, at least to some extent, succeed at that. If they are really targeting significant large scale, such as really getting things scaled up in countries or multiple countries, the chances of failure will go up, but the returns could be astronomical. And this is a challenge, I think, that hopefully we can also explore in the case studies. So thank you very much. And I'll turn it back over to you, Larry.
Thanks, Richard. As probably anyone listening will know, this is a formidable task, but it's worth the effort, at least in the opinion of many of us, in the sense that if we're going to look at things like the Sustainable Development Goals or the climate goals, those are problems that exist at scale, and there's no point talking about them if we're not going to be serious about trying to remedy them. The kinds of issues I won't try to reiterate in any way, shape, or form, except to say that we're battling pretty fundamental issues here about timeframes, about project models, and about locus of control on this, and trying to figure out where and how even well-intentioned people can begin to move this needle, I think is at the essence of what the mainstreaming study is all about. Here comes a kind of a practical approach to that in the form of what CRS is trying to do with the Global Fund. So in focusing on something called the high-performing implementers, CRS is trying essentially to replace itself in the role of being a principal implementer for the Global Fund by finding countries and organizations that they can in turn reasonably strengthen or hand off to in this effort. And leading that process is Bridget Bucardo Rivera, who's going to now share with us a little bit of that experience.
Can everybody hear me okay? Thank you so much, Larry. Can you hear me?
Yes, we can.
Yes.
Okay, great. Thank you. So thanks so much for having me. I wanted to share a few thoughts and background on the High Performing Implementers Initiative, as Larry mentioned. I'm Bridget Bucardo Rivera. I'm actually a senior technical advisor for capacity strengthening at CRS, but currently leading this High Performing Implementers Initiative within our Global Fund programs. So it's a pleasure to be with you all here. And I think as Larry or Johannes mentioned, we'll have sort of a fuller session on this initiative called HPI in April. But I wanted to just give you a taste or a sense of what the initiative is and how it relates to scaling. So I won't have any slides, just speaking with you, just sharing sort of informally some of the background on this initiative. So the Global Fund is, as I'm sure you're aware, is a donor that's always been focused on locally led solutions at the scale of the disease burden in a country. So they work on malaria, HIV/AIDS, and TB. And one of their core principles is country ownership. So they really are seeking to directly fund national actors as principal recipients at wherever possible. CRS has been a principal recipient in many countries working with Global Fund over the years, but CRS also has a core principle of local leadership and really fostering that local leadership and being a catalyst for the impact at scale that can be achieved best by permanent local actors. And so that's where this HPI initiative comes in. So this the High Performing Implementers Initiative is really an initiative that CRS is investing its own funds in, as well as the Global Fund. Although as time goes on, we expect the Global Fund to increasingly, kind of invest more and more, and CRS putting less of its own funds. But we believe in this so much that we were willing to sort of really, kick this off with a co-investment. The purpose of HPI is to accompany national government partners to become and remain strong implementers of Global Fund grants. In many cases, these national government partners are well poised to become future principal recipients, and CRS is supporting them to meet those Global Fund standards of principal recipients. We don't make the decision on who becomes the principal recipient. That's the decision of the country coordinating mechanism and the Global Fund in some cases, but we can help these national government actors meet the standards that the Global Fund has for those principal recipients. In other cases, the government partners will remain strong sub-recipients, but they're really key implementers of Global Fund grants. So they have a key role in disease elimination in the country. And so we also want to help them to sort of be as strong as they can as national or subnational government actors. So where and with whom are we implementing HPI? So in the current grant cycle, the grants are 3 years, so it definitely resonates what Richard was saying about time constraints and the constraints of project cycles. But in our current grant cycle, we're implementing HPI with national disease programs in 5 African countries. So Guinea, Madagascar, Mali, Congo-Brazzaville, and Niger. In the next grant cycle, we're proposing to offer HPI services as a service provider to other national government partners in additional countries. So we've been asked to do that by both these national partners and the Global Fund. So we will most likely be expanding to other countries as a service provider, not as a PR or as a SR. So how does HPI work? CRS essentially these national government partners to first develop a vision for their role in improving health outcomes in the country. So we really kind of want the partner to be in the driver's seat of sort of what is their own vision for disease elimination in the country? What role do they want to play? And then there are 4 capacity areas that the Global Fund looks at in terms of being able to lead this disease elimination in country. And so within those 4 areas, which I'll talk about in a minute, CRS supports these national disease programs to first identify their capacity gaps vis-a-vis Global Fund standards for principal recipients. So we do that through a partner-led CRS facilitated capacity assessment that's based on the Global Fund capacity assessment tool. This is their assessment tool that they use to determine whether any partner can receive direct funding. So we've taken that tool and turned it into a partner-led self-assessment where the national partner themselves can say, okay, this is where we think we're strong, this is where we think we're weak in these different areas of grant implementation, grant management, this is where we want to prioritize to work on. Based on that, we support the disease programs to implement action plans based on what they've prioritized in terms of their capacity needs, and then we accompany them to implement these plans, support them to measure progress annually towards achieving these Global Fund standards for principal recipients, and then help them to document and communicate their progress to country stakeholders. So this is really a holistic sort of partner-led capacity strengthening approach that we are applying. So how is HPI different from sort of other technical assistance in the Global Fund space? Certainly, there's a lot of technical assistance that goes on, and so how does this sort of how is this different, right? So traditional technical assistance within Global Fund grants typically been short-term and is short-term. It's problem driven, right? So there's a problem with a partner not meeting, expectations, or there was some, issue with fraud or XYZ. And so often technical assistance is driven by that. Short term, it's problem driven. And often it will result in a set of recommendations or actions. So the development of a policy, right? An organization comes in and helps to develop a policy or does a training. But it often does not lead to sustainable capacity improvements within the national partners. And so HPI is different in the sense that it is partner-led. So typically, within traditional technical assistance, the partner is passive. Even with the assessments, they're passive. If the assessment is done to them, not by them, right? And so right from the beginning, they're playing sort of a passive role in their own development and strengthening. And so our right from the beginning, CRS has sort of flipped that and said, no, it's more important that the partner be the proactive actor, be in the driver's seat, than that the assessment is perfect. It's more important that they're in the driver's seat and that their commitment is built right from the beginning, and that they decide where they feel their capacity needs are and what they want to work on. So that's one sort of key difference. I would say the second key difference is, traditional technical assistance, as I said, is developing a policy. Here's the policy. There's very little follow-up usually in terms of, is that policy is it functional? Do people know what it is? Do they know how to use it? Similarly, there's lots of trainings done, right? Is that learning being applied? Do people feel comfortable applying that in their work? Is there enabling environment for them to apply that in their work? And so really, we have a very strong emphasis in HPI on accompaniment, that follow-up. So if there is a training being provided, whether it's by CRS or another organization, making sure that there's that follow-up accompaniment so that the knowledge and skills can be applied by the national partner. And similarly, that whatever policy or practice is put in place, that it's functional, that it's disseminated, that it's institutionalized within the organization. So I would say those are some of sort of the key differences. So once we work with the national partner to sort of identify, they let us know sort of where they want to prioritize. There's 4 key areas that they look at and that we support them in, and these are governance. So this includes, human resources management, risk management, strategy, things like that. Then financial management is the second area. The third area is M&E, program quality, and we've also added digital campaigns as sort of an add-on because it's a critical piece of their work as well. And then the last area we support them on is procurement and supply chain management. These services that we offer can be, done modularly or as a whole. So in some cases, we're just providing very specific areas of support based on what they've asked for, like in the case of Niger. In other countries, we're providing support in all these areas. It's really driven by what does the partner prioritize that they want to work on? What do they feel is manageable and feasible for them? And really, we take it from there. So the last point I wanted to share was just on results to date. So I think we started this, like I said, in this first grant cycle, and really we've only started offering the services, right? Helping the partner to implement their action plans by deploying a set of technical advisors that we have, using a set of sort of capacity strengthening solutions that we've developed, or HPI solutions as we call them. And so we really just started this year, right? That the implementation is really going on after setting the groundwork last year with the assessments and the visioning and all of that. And the results to date, I think we've been really surprised that the national partners, I think, really have welcomed this approach. I think they've said to us very directly that this is the way this type of support should be. And they, kind of shared that they were very frustrated in the past by even just starting at the assessments. Assessments are often, not even driven by them or shared with the donor before they've even had a chance to sign off on them or agree to the findings. And so I think they really have welcomed this sort of partner-led approach, the fact that they can determine what areas they want to prioritize, and we will support them based on their own priorities and also help them sort of track their progress toward meeting these standards. So just some of the things that we've supported these 5 different countries on so far is developing and implementing risk management policies and risk mitigation plans. We rolled out a 6-week leadership development program based on their priority to sort of strengthen their leadership and management skills of the top leaders of these national disease programs. We worked with them on improving, or in some cases developing, financial procedures and financial, internal control manuals. We're working with them on improving performance management, retention and recruitment practices, things like that. So it's really just, in the first year of delivery of these services, but the feedback has been really positive. So looking forward to sharing more with you in the subsequent upcoming webinar, but back over to you, Larry. Thank you.
Thank you, Bridget. Just to draw out one point before I turn to Julie on this, which is to say that I think we've come to understand that when you're thinking about scaling, one of the key questions is who is going to be the implementer and who's going to be the funder at scale. Not who's funding the pilot project and who's implementing the pilot project, but if this thing were going in perpetuity and we're going at the scale of the problem, who would be doing it and who would be paying for it? And to oversimplify slightly, paying for it is going to, in almost all cases, end up being the host country government and or private markets, sometimes done through social enterprise. But unless there's some recurring source of funding, either tax revenue or sales revenue for whatever the service is, the chances of being able to sustain it at scale are minimal. The other side is institutional capacity. So the ability to carry these things forward is dependent upon in-country organizations that are not project organizations, that are basically ongoing operational organizations. And the question becomes then, what can funders that are giving short-term time-bounded funding do to help create a permanent capacity on both the financing side and on the implementation side? What you just heard from Bridget is one honest attempt on the implementation side to try to have a series of actors at the country level that can be supported initially externally, but that can have some longevity as well as capability to move forward. This is exactly the crosswalk between mainstreaming and localization. Julie, I want to turn to you now, if I could, to pick up the storyline, at least partially from the AID perspective that you used to occupy on this, and some of the battle scars of trying to get a perspective on scale really incorporated in the agriculture sector.
Great. Thanks so much, Larry. And that I really am sort of standing on my chair applauding CRS and Bridget's. That really speaks to some of the problems that you'll see I've identified with the Feed the Future approach. But anyway, thanks for inviting me. And I'll be focusing, as Larry said, mainly on the scaling experiences of USAID's Bureau for Resilience and Food Security. A decade ago, I served for 3 years as chief scientist for the Bureau, which was then called the Bureau for Food Security. And those were really heady times for those of us working on agriculture. President Obama had just announced this new presidential initiative, Feed the Future, which was the US government's response to the global food crisis of 2007 and 2008, which before the current Ukraine crisis was sort of the reigning major food price crisis of the last several decades. So let me give you sort of 5 quick background points on Feed the Future. First of all, it expanded U.S. funding for global food security nutrition programs to $1 billion a year after a very long period of funding decline during the 1990s and 2000s. And so the $1 billion per year became a kind of new floor. It's been maintained in the years since and sometimes expanded. And this initiative, this is important, has benefited from pretty strong bipartisan congressional support. Second of all, Feed the Future is a whole U.S. government initiative, which was something quite innovative, and as you'll see, something quite difficult. Responsibility for its management lies with USAID, but 11 other federal agencies are part of Feed the Future, including State Department, Treasury, USDA, Millennium Challenge Corporation. So the very good idea was to try and harness the programs and resources across all these agencies who are working in some way in the focus countries of Feed the Future to better meet sort of the collective objectives of Feed the Future in these focus countries. And so from the beginning, Feed the Future included a very large focus on scaling. Why? Well, there was this nagging worry for decades, really, that investments in agriculture since the Green Revolution, since the 60s, really weren't having enough impact. And it was partly due to funding, but not totally due to lack of funding or lack of technologies. So, you know, we all sense that many technologies were out there. They'd been developed to help farmers grow more productive, healthier, resilient crops and animals. There were lots of pilots. There were a lot of evidence that if the pilots could be taken to scale, millions of people's lives could be improved, but that just simply wasn't happening. So with an abundance of high-level support and also a lot of pressure, you know, from the USAID administrator and the Secretary of State, and occasionally the White House itself, the Bureau for Food Security set about working closely with its partners, its research partners in the CGIAR and U.S. universities, with USAID missions and their portfolios and partners with development projects to really try and figure out what steps might be taken to better link these technologies and innovations to scaling pathways and partners at the country level. So I'm not going to go through this in detail. I think, broadly speaking, Feed the Future's results reported annually have been pretty encouraging. In its focus countries, for example, the work has resulted in 23.4 million more people above the poverty line, 3.4 million more people free of stunting, 4.8 billion in financing unlocked for SMEs, et cetera, et cetera. And there's much more information available on the Feed the Future website. So I want to spend the next bit of time sort of like thinking about looking over a decade. What can we say about how and how well scaling has been mainstreamed in Feed the Future, not only in USAID, but other agencies? So what key steps were taken to mainstream scaling? Well, first of all, important to remember that back in ancient history in 2011, there was very little information, very little evidence or analysis about scaling in agriculture. In fact, we drew really heavily upon the people you've been hearing all day today from Johannes, Linn, from Richard Kohl, from Larry Cooley. Each one of them were really instrumental in helping us figure out what does scaling mean for Feed the Future? How do we drive forward this? So our early scaling efforts really focused on providing technical assistance to help missions at the country level and country partners, but really primarily missions, develop a series of what we called scaling action plans. And these plans identified a limited set of technologies and programs that were felt to be the strongest candidates for sustainable, broad-scale, high-impact population scaling. So technical assistance teams, including Richard Kohl was on many of them, worked with focused missions and partners to review, revise, and track progress on the scaling action plans. So I just want to add sort of a parenthetical remark here, is that this was quite difficult, hard on missions, right? So this was having your ambassador, it was having the USAID administrator, it was having all of us sort of in the face of the mission and the focus countries all the time. What's your scaling action plan? Is this going to work? Technical assistance team. So, it was sort of another thing for them to cope with on top of their regular, all their responsibilities, programs, and projects they had to deal with. So I would say, that sort of enjoyed mixed popularity with the missions because we were saying, you must come to population scale. You must do it within this time period. The administrator, the president of the United States is working for you. And frankly, I think that focus on scaling action plans and tracking and all hands on deck, not able to sustain that, over the course of Feed the Future. It's sort of come back to become a more technically focused initiative. So, but that was a very important part of Feed the Future at the beginning, these scaling action plans. So in addition, at the beginning, RFS, BFS engaged scaling up experts like Richard and others to build up a body of scaling case studies, drawing on work funded by the US and others. And so Bureau, technical personnel, external experts also developed embedded a toolkit that could be used by missions and partners to assess the scalability of innovation. So, I think we've come a long way, from this kind of blank slate of not having really any tools to work with, to having quite a bit of technical resource. So in recent years, long after I left, very specific to agricultural research investments, a research rack-up tool has been institutionalized within the Bureau to identify innovations with high potential for scale and try and match them at an earlier stage with resources and networks to put them in the hands of farmers and private sector. So RFS, the Bureau has also instituted a pretty rigorous product life cycle. So completely different way of managing agricultural research investment that integrates scaling criteria into stage gates. So that's quite a new way, I think quite a significant institutionalization of scaling. So let me say, I think all of this work over the time, from the beginning up till now, represents some pretty critically important technical scaffolding for continuing and improving the effectiveness of scaling efforts and represents a kind of mainstreaming of scaling. I think it couldn't be sustained at the high political level, but it has been sustained at a technical level. And that's evidenced by repeated references to scaling in the Feed the Future Global Food Security Strategy, which is mandated by Congress, and also the operational strategy for the RFS Bureau also focuses very heavily on scaling. So now let me get to the challenge part. Some of this is echoing what Richard said. So I think, looking back over the last decade, today we've got a much greater focus on scaling, not only in USAID, not only in Feed the Future, but also, as Richard said, in health and education. We also are finding a greater emphasis on scaling in other bilateral donor organizations, notably GIZ, CGIAR, and I find the discussion on vertical funds, which I'm less familiar with, but also very, very interesting. So, scaling has emerged as a top priority following the major reform recently undertaken by CG, and tune into our ARD workshop session next Monday to hear from the CG's top scaling expert on how they are proposing to mainstream scaling there, and also get some reactions to that approach from civil society representatives, private sector, and the government. So in my last bit of remarks, I'd say there's been a lot of progress, but I think it's mainly been on improving sort of the technical tools to do scaling. So I'm not sure, there's mainstreaming scaling faces some pretty major challenges. And let me sort of break those down into 4 off the top of my head. First, I think, there are problems with the Feed the Future in sort of knitting together efforts across U.S. government agencies, and then knitting U.S. government agency efforts together with other donors, other funders. It's very, very difficult. So, it seemed at the outset there was great potential for mainstream scaling, across all these 12 agencies, U.S. government agencies. But when you think about it, in the day-to-day, the operational guidance of each agency differs. USDA, it doesn't say anywhere in their mandate that they're supposed to be, helping farmers in other countries improve their productivity. There's some of their projects do that, but it becomes kind of sort of a political red flag, and has gotten USDA in trouble decades ago. So the operational guidance of each agency differs. It's been difficult to come up with a viable reporting framework that captures the resources invested by all the agencies and the result achieved across all of them, even in the same countries and same regions, just for U.S. government agencies. So, a recent GAO report that came out sort of pinged Feed the Future on this and said, USAID and its partner agencies are really limited in their ability to use performance data to assess the initiative's progress. So they effectively said, we don't know how well Feed the Future is really doing because they've been unable to set Feed the Future-wide performance goals and establish indicators that would meet the standards of performance indicators. So that's one thing. So, hard to knit together the agency's efforts, even within the U.S. government, and then hard at the country level to knit together efforts with other funders, from other bilaterals and with the other private sector, et cetera. So let me turn to the next point here. I think the other point that we would say, and this is specific, a little bit specific to food and agriculture. Coordinating parallel but related scaling efforts by different sectors in the same countries or regions, it remains a real challenge. So, regarding global food security in general, improving the coordination of scaling efforts across sectors as well as within sectors has become especially critical because just in the past couple of years, we've had this major shift from an almost exclusive focus on agricultural productivity to a broader food systems approach that explicitly recognizes the relationship of the food system to human health, environmental sustainability, economic development, resilience, and equity. So this new framework and the imperative to address these multiple objectives, it just makes your head explode, right? It adds a tremendous amount of complexity to all aspects of the scaling process when we're not doing all that well with just sort of the focused sectoral approach. So as Richard and others have said, then I would say, fundamentally, but investments are still project driven. They're still sector driven, which means they become siloed within organizations and across organizations. And so I have to conclude efforts so far to mainstream scaling in our ag and food security space have not effectively addressed this key challenge, which will require really fundamental change in the way investments are made and the way that progress is measured. And maybe, the progress that Bridget spoke of and what they've been able to accomplish with the Global Fund as partner is the way forward. So, and that speaks to my next and almost last point, Larry. I'd argue that what we need now is really less focus on improving scaling within individual funding organizations. And we need, much to what Bridget was talking about, more attention, more incentives, more resources directed to country and local levels. So the key question for me is, what will it take to encourage collaboration across funders, projects, and sectors to fund countries' own priorities and build countries' own capacity for scaling? So the question is for funding organizations, how to create a scaffolding, to enable them to collaborate together much more effectively to support countries in the realization, because countries and national partners really are the only ones who will be able to carry forward scaling in a sustained, effective way. So one last point. I think critical and related to this is that the scaling mainstreaming efforts at Feed the Future, others I'm aware of, haven't been able to pay adequate attention to investing in the multi-stakeholder partnerships at country and regional levels that are just essential for scaling. So these are communities and civil society, government agencies, and private sector. So intermediary organizations who are almost invisible, but so important to knitting together. And I see CRS is doing this kind of work. They're needed to do this hard work to develop and maintain these partnerships, but they're almost invisible, and it's been so difficult to get funding for it. Okay, there's so much more to say, but let me not say it now. Okay, Larry, back to you.
Thank you for what you did say, and I hope everybody feels as validated as I do in having chosen this as an area for attention. And I can't think of anything more important to our collective enterprise than trying to get this right, this mainstreaming issue. And clearly, we've done some important things, but the larger work lies ahead. And I want to leave you with just a thought before I hand over to Johannes for some closing remarks. It's tempting when you deal with complexity of this sort to take a weakest link approach and say, well, if we don't do everything, we might as well not do anything. And I don't think that's validated by the experience nor by the progress that people have made so far. I'd rather have people think of this as an array of possible entry points into a complicated problem. And not all of them, but many of them have the ability to then act as drivers for other changes. So I think part of what our study is going to be over the next year is not only what all the constraints are and what all the things are that would ideally line up, but where can you penetrate that system? What is it we want to push organizations to do that is not asking them to do what they can't do, but is asking them to do what they can do and should do? And that, to me, ought to be the focal point for our research over the next year, as well as for our advocacy. And I'm really inviting, this is not an empty invitation. This is a real invitation. I'm inviting all of you on the call, the 90 of you who are listening right now, to really see this as your fight too, and figure out what we need to do to learn about this, and then what we need to do to act on what we learn. Let me hand over to Johannes for some final remarks. Thank you all very much.
Thank you, Larry, and thank you to the panelists, and thank you all who were listening in, and for those of you who tried to and actually succeeded in sharing also questions and comments. I had subtract here 4 in particular: Erin on innovation, Jenny on what is the Brookings Center on Education is doing, and by the way, very helpful to us looking ahead. Jan Lowe, if I pronounce it right, Jan Lowe, maybe question on EFAD, which I'd be happy to follow up because I actually worked intensively with EFAD for a number of years. And then Tanya raised a question on partnerships. So I may have missed a few and I apologize, but let me just assure you that this is the beginning of a conversation. So if we didn't have a chance to really get into the conversation as we would have liked to today, but with the benefit, by the way, I felt, of hearing a lot of very important contributions from our panelists. So if we didn't get into that conversation, please join our working groups. If you're interested in the mainstreaming question, working group meetings that deal with these questions, and actually, I just learned, I didn't realize what Julie said, that the ARD, the Agricultural Development Working Group meeting, also will actually address some of the issues on mainstreaming. So join those meetings, and then keep track of our invitations to webinars. Please let us know individually if you'd like to contact us to sort of share experience or raise questions, or perhaps offer us the opportunity for a partnership as we move forward with the research. Now, just we have about 2 minutes left. Let me just flag a couple of things that I take away from discussion. First of all, as Larry said, while there are a lot of challenges, and I personally, frankly, have struggled over the years in keeping up my own spirits when working with organizations on trying to help the mainstream, and then finding a year later that very little seemed to have stuck. But I don't think it's hopeless. And if you look at the vertical funds, if you look at the CRS experience, if you look at others, that sort of bright lights that we've heard about, first of all, there is an acceleration and intensification on this across the board. Now, a lot of people who didn't talk, and organizations who didn't talk about scaling 10, 15 years ago, now are talking about it. And so that, to me, already is tremendous progress. But then I think there, you know, we all stress the complexity of dealing with this, but actually, I also think there's some very simple, low-hanging fruit that we can pick as funders. So, for example, I mean, all of us have project concept papers. All of us have midterm reviews when we do funding. Not all, but most of us sort of have something like a midterm review where we focus on, so what do we need to do to finish off the project to meet its goals? Well, at the beginning, as well as the midterm review, we should systematically ask ourselves, so what happens when the project finishes? Who will continue it? Who will fund it? Is the political, how do we make sure that the stakeholder ownership is there? Those questions should be asked at the outset, and they should be asked at midterm reviews. And we shouldn't just focus on the question of how do we deliver on the narrowly defined project results, and how do we make sure the money isn't misappropriated, and so on and so on. We really have to ask that additional question: what happens after the project is finished? And my view is that if we just put that question on the table centrally and systematically in the way we deal with our quote-unquote projects, I think we already begin to shift the mindset. And so I would encourage you all, when you are dealing with your projects, with your programs, ask yourself and ask your colleagues and ask your funders this very simple question. So beyond that, I think, you know, the partnerships issues that were raised, of course, are very difficult, a lot of challenges, but there my experience would say, well, don't try to bring all potential partners to the table right away. Start with a few where you really think there's a potential for aligned objectives, aligned approaches, and work with those. I think the intermediaries, which CRS pointed out, is really critical, and what Julie said also on this, and Larry, I think we need to work much harder to support intermediaries who can outlast the project and continue the work beyond. Sustainability focus, this is the point that Larry made early on, who will actually finance and engage after the project is finished. It gets back to my point. And finally, the question of indicators. Yes, it's tough to have good indicators for successful partnerships, for other elements, capacity development, but actually, as the Center for Education, Universal Education, and MSI have shown, there actually are some good tracking mechanisms, and we in our research, action research going ahead, will try to develop some tracking mechanisms. And obviously your input on this will be much appreciated. I apologize for going 2 minutes over, Larry. I probably missed a bunch of things I should have said, but thank you all. And we really look forward to working with you going ahead. So great session as far as I'm concerned, very helpful in getting us started. And over to you, Larry.
Come back tomorrow, everybody.
Yep,
We'll look
indeed.
forward to seeing you all same time, same place, different topic Tomorrow's topic is the role of IT as a potential game changer, the promise and the peril associated with IT. And we're going to look at it from the point of view of agriculture, health, and education. Come back. I promise it'll be interesting. Thanks for today, everybody. Bye-bye.
Take care. Bye-bye.